Hello and welcome to The Gentle Shift, Health by Choice, Not by Chance. I am Dr. Aaron Kiefer, and I want to welcome you and thank you for joining me today. This is episode number 2. And as a newbie, I recorded this episode earlier and apparently forgot to record the audio. So awesome, we all make mistakes, and I am definitely learning as I go. The video worked just fine, and when I clicked to watch it, no sound. So here we are, episode number 2B, I suppose. And today I'm going to be talking about how the body is self-healing and talk about the differences between the natural health world and the more traditional medical world. And I want to have a quick disclaimer because there are people coming from all sorts of different ideas of health, and we may even have some medical professionals listening. And so please do not take the things we're talking about as something that's offensive. Don't be offended by what we're talking about. Don't be offended when I make general characteristics about, especially the medical field. The idea is to help you to understand how the two fields are different. And with that understanding, why the people in the natural world may make some of the decisions that they're making regarding health, and specifically how to restore health and how to treat health. And so the first thing I want to talk about today is that the body is actually self-healing and self-regulating. And this is a really important concept to understand. And it's really empowering, because if the body can heal itself, that means that all we need to do to get better, to get healthier, is to restore that ability for the body to heal itself. Oftentimes, conditions that are causing an issue for someone are simply the body is having trouble healing to the degree that it needs to heal. Maybe it's taking on too much trauma or too many insults that are causing the body to be overwhelmed, or maybe the body's capacity to heal itself has diminished for some reason. So the body is self-healing and self-regulating. So what does that mean exactly? What that means is the body can replenish its cells that have been damaged and start over, right? Start fresh. And that's a key understanding. If we are not self-healing, then there's no point in even trying to do things to improve ourselves, right? Because essentially we are where we're at right now, and we're only going to get worse. But if we are self-healing, we can improve over time. The body likes to heal, and the body likes to function at 100%. And so the body's always seeking to get there. And the body uses a lot of different methods to heal itself. The immune system is huge in that. The immune system is going to help to take out the cells of the body that might be damaged, to enable the body to start to lay the foundation with new cells, to start to build up that muscle or whatever the tissue may be, to rebuild it so that it can function correctly again. It's truly amazing. Our bodies are designed so intelligently. If anything else in our world that was not a living thing was self-healing, we'd be really appreciative, right? Our cars break down. If it's healed itself, we just need to give it time. But unfortunately, that's not what happens. With a car, we have to replace parts to enable it to get back to 100% function. In some way, our bodies replace parts too, but it's replaced at a microscopic level, cell by cell. And the body is also self-regulating. It controls our hormones, right? It controls our heart rate. It controls our breathing. These two concepts are key to health. and are the reason that we can make decisions that might be poor and we can reverse them in the future. Obviously, sometimes you can't reverse them 100% depending on how much damage may have occurred leading up to that point. But we heal ourselves. And so there's a disconnect between the medical world and the more natural world, not necessarily about the body's ability to heal itself, but more about appreciating that and either working for or against that. And so in order to understand how our podcast is going to go about, you need to understand the difference between the two professions and how the two professions ultimately are viewing an issue and then what their response is to that. And once you understand that difference, then you can understand or have a better appreciation for how we're going to go about our process. And so, I'm in the natural world, as a NUCA doctor, as a chiropractor, this is what I do on a daily basis. And so when we look at the two health professions, they both believe that the body is designed in some incredible way. The natural world believes the body is designed intelligently, and that when there is a symptom or there's some sign that's present, it's an alarm, and the body's telling the person or the healthcare provider something's wrong and something needs to be fixed. The natural world believes that those signs and symptoms are correct and merely a signal to provide guidance to know what to do. The medical world as a whole looks at a symptom or a sign as the problem for the most part. And so their goal is to eliminate that sign or symptom. So it's like if you have a fire in your house and the smoke detector is going off. In the natural world, we're looking at the smoke detector and saying, okay, where's the fire? And the medical world is looking at the same situation and they're going up to the smoke detector and they're taking the batteries out because clearly the smoke detector is doing something inappropriate. It's not performing correctly. And obviously, sometimes in our bodies, the smoke detector is not performing correctly. But most times, that smoke detector is performing correctly, and you need to look for the fire. Look for the smoke and then look for the fire. And that's what separates those two professions is the medical profession simply believes that correcting the alarm, stopping the alarm is enough to bring that person back to health. And the natural world believes that there's more to it to get that person back to health. And so it's not just simply getting the sound to stop, but instead putting out the fire and, also looking at repairing the damage that may have occurred from the fire. The symptoms are, for the most part, our body's ability to adapt to a situation while also letting us know that it's not happy with that adaptation. Our bodies can adapt to so many things. We can go outside in the cold and survive. We can go outside in the heat and survive. We can have so many different insults coming at us, and our body can not only survive, but oftentimes thrive in a not so perfect environment. So it adapts. It's amazing how well it adapts. However, adaptation does not mean the body is happy with the current situation. It simply means it is figuring out a way to survive and figuring out a way to thrive. So when the medical profession observes a symptom, in general, they believe that symptom is incorrect, that the body is flawed, and that they need to step in and override something. Perhaps it is removing that symptom, or perhaps that is removing some part of the body that might be flawed. Their solution for treatment is oftentimes medicine of some sort, which for the most part, most medicine is designed to simply remove a symptom. Or another option can be obviously surgery, which is obviously more extreme, but surgeries are done rampantly because apparently there are a lot of flawed bodies out there. So the medical profession acts or believes that they are smarter than the body. The natural health world has a reverence and respect for the human body and believes that everything that is occurring is appropriate for the current situation that the body is in. And instead of trying to interfere with that process, instead tries to improve the situation, improve the environment, and help the body to function at a higher level. And so overall, this is why the medical profession is extremely great with emergency care, but they fall short oftentimes with wellness care. These general characteristics have indoctrinated our population and made them feel victims to their symptoms and their conditions, instead of allowing them to know that they have the power and to realize that they have control of their situation and sometimes can make drastic changes to their overall health with oftentimes very simple changes to their life and to the things that they're doing on a daily basis. So this difference between the two professions is why they oftentimes think the other profession is crazy. Overall, I believe that we are seeing a change happen and more people are trying to find the root cause of their issue. And so more people are seeking natural health care to find that. And it isn't that the medical profession doesn't want to find the root cause for some things. I think a lot of doctors and healthcare providers feel almost imprisoned by their own profession, and they don't feel like they can necessarily reach out and try to find the issues like they would like to. And I think that's why many people in the medical world, when they start to try to find the root cause and they start to make a career out of it, that they become so well known because they are so unlike a lot of their comrades. I think a lot of our population is realizing that treatments are aimed by the medical profession, treatments are aimed largely at treating a symptom, making a symptom go away, and not necessarily at trying to improve the situation as a whole. And they've also realized that oftentimes when you remove a symptom and just treat a symptom, it can cause other issues. You know, you have side effects from medication, or you have lasting effects from surgeries. And people are becoming more and more aware that they would rather treat the cause of an issue, even if it requires maybe more work from them, than to simply remove that symptom. And when it all comes down to it, these are the two things that separate these two professions. That mindset of once a symptom occurs, what's the next step? What's our goal? What are we trying to do? You know, removing the symptom oftentimes brings comfort to somebody. You know, I was just sick. I haven't been sick in a long time. And my initial reaction once I had the very first sign, which is a very, very slight sore throat that I woke up with, was to start to increase supplements and to clean my diet. We had been traveling. We had been away visiting family. And there's a lot of stress that comes with that. And so the focus was increase supplements, increase water intake, watch my diet as well as I could, given the circumstances. Obviously, a lot of times when we travel, we don't eat as well as we should. and I focused on getting some sleep. And so my symptoms were minimal because I had helped to boost my body at a time that it needed to be boosted some. And I paid more attention to my body at a time it needed more attention. Perhaps if I had given that the body the attention for the couple days leading up to that, maybe I could have completely avoided symptoms. My body would have been just fine. But that's the difference between the natural world and the medical world. The medical world is going to look at that sore throat and look at that snotty nose, and they're going to say, okay, what do we do? Maybe you need to take a decongestant, right? Let's clear that snot out. Well, snot's actually really important. It has antiviral properties. It has antibacterial properties. Snot actually kills viruses and it kills bacteria. It is really, really important. Probably drive people crazy because when I'm sick, I don't blow my nose a lot. I'm just sniffling. I know it's not probably socially appropriate. However, that helps my body get over things quicker. You keep taking that snot and blowing it out, you're wasting energy, right? Your body has to produce more snot. Have you ever noticed that? You blow your nose and a few minutes later, you have more production of snot. There's a reason for that. The body's using that, right? It's helping to clear things out. It's helping to kill things off and clear things out, get them out of your body. And so by consistently blowing your nose, you are losing some of that effect. So stop interfering. And that doesn't mean I never blow my nose, of course, but what it means is I let that sit for a little bit. And I've heard some people go as far as to put something in their nose to basically hold all the snot in to allow it to really cook in there. I think that's kind of interfering with the body's processes too. So I kind of let it run and wipe my nose as it's running. Don't blow my nose that much, though. I don't force it all out. And that sums up the difference between those two professions and an example of how they perform differently in a situation that there are symptoms present. And, once again, the medical profession in an emergency case, fantastic. If you have an auto accident, you get seriously injured or have a serious illness you're going through, they do really, really well at that emergency care. However, once you get to a certain level of health, they just really struggle to bring you higher because they just don't. I won't even say they don't know what to do. They just don't take an active approach in that. And maybe that's ultimately the difference is they just don't care about bringing you from, let's say 70% to 100% of health. They care more about getting you from that 0% to 70. And maybe that's the biggest difference between the professions is not necessarily knowledge or know-how, but just a different mindset of what they are trying to accomplish. But overall, there is a difference between the two professions. And there's a reason that there's a lot of people that are seeking the natural world, both for the treatment of conditions as well as to increase their overall baseline of health. In future episodes, we're going to be talking to and interviewing people that are in that natural health world and with an understanding of where they stand and how they look at health as a whole and look at treatment of symptoms as a whole that can help provide guidance and understanding into why they do the things that they do. So as we progress through this journey, I hope you are going to hop on this kind of crazy train of natural health and mindset, and you can embrace some ideas that can help you to raise your baseline of health. So I encourage you to look at some of the things you do as you are going through your day and going through your week, and look at some of the things that you're doing and step back and figure out, are you working with the body and trying to supplement the body to be better, or are you working against the body? And you'll find that there are a lot of things that you do that are part of your just daily rituals that are probably working against the body. I'm guilty of that as well. And so pick a few things and think about them and think about why are you doing the things you're doing. Oftentimes we're making those changes just for comfort more than anything. And figure out maybe what you can do to enhance that process instead. Thank you for joining me in today's episode. I am really looking forward to doing some future episodes where we are doing some interviews. And for now, I am going to bid you a farewell, and we'll see you again. This is The Gentle Shift, Health by Choice, Not by Chance. I am Dr. Aaron Kiefer, and be well.